Major debate is underway over whether it's time to legalize marijuana for medical purposes. So far, medical marijuana has been legalized in 14 states, and there's legislation now pending in many others, including Florida. Opponents say this is a gateway drug and it's a terrible idea. But there are others who found healing and relief in cannabis. Meet Denise Houston, a 55-year-old grandmother who's active in her community, has a passion for quilting, and who says she'd smoke marijuana if she could.
It's not all stoners that want this legalized. I am not a stoner. I am a patient.
2 years ago, Denise was diagnosed with breast cancer. The treatments left her feeling sick with severe joint pain and chronic depression. The medications her doctors prescribed did little to help.
I couldn't get out of bed. I wanted to, but my mental caused I just physically couldn't do it. So I tried it.
The marijuana Denise says she tried put an end to her nausea, took the focus off her pain, and lifted her depression. It even helped with her migraines.
It helped me through a very hard Christmas. It made me realize at that time it's a medicine.
Marijuana is now legally considered medicine in a growing number of states, but not in Florida. Denise would like to get the treatment she says she continues to need for joint pain and depression, but she can't.
I won't. The legal ramifications are not... I would move to another state if I could, but I don't feel that after I've contributed to my community, I should have to.
Denise has found a kindred spirit in Diane. They met through an organization called People United for Medical Marijuana. Diane had a series of failed back surgeries that left her with a painful nerve condition.
Nerve pain is like having fire and ice in a sword stabbing into you that you just you can't get away from it.
Diane would also like to be able to get a prescription for medical cannabis, which she says would have far fewer adverse side effects than the pain meds now notorious for so many addictions and ruined lives.
When you're in pain, or people with cancer, or so many other conditions this is helpful with, even arthritis. Why would somebody have to take an unfriendly substance?
The list of diseases and conditions marijuana is said to improve is a long one, from cancer to fibromyalgia, from Parkinson's to Alzheimer's disease, from hemorrhoids to hypertension.
I think it's really a control issue.
Moffitt Cancer Center physician Dr. Sloan Carver says patients need to be discerning about the myriad of health claims linked to the cannabis plant.
We need to be very careful when we see those lists of potential ailments that the marijuana can help, and look at it with a keen eye to know what, in fact, it can do to benefit our patients.
There is a synthetic form of THC, the active ingredient in marijuana, called Marinol, which is legal in Florida. Dr. Carver does prescribe it for some of her patients.
It can stimulate the appetite. It can also help their mood and just give them a sense of well-being.
But advocates of cannabis say Marinol is not the answer, not only because it's expensive and often not covered by insurance, but also because drug companies have been unable to duplicate all the compounds that make the natural plant effective.
It's lacking. It's like making a cake with flour and nothing else. You're missing so many vital ingredients.
But is Florida ready for medical marijuana? Dr. Jay Wolfson of USF Health says it's a social and a political issue.
It's a tough call for Florida, especially with the current composition of the legislature and the governor. It's unlikely that it will even get out of committee in either the House or the Senate, regardless of what the data indicate.
But Dr. Wolfson says it's important to separate the politics from the science.
The data are very interesting. For the most part, there are some clearly demonstrable positive effects of medical marijuana use for certain conditions, certain diseases, certain disorders.
But then, how to control it? Documentaries like How Weed Won the West by filmmaker Kevin Booth have chronicled the exploding popularity of dispensaries in states like California.
This is a relatively unique variety of medical cannabis. It's
In places like Colorado and California, there's a spree going on right now because people are trying to figure out not only how to capitalize on the marketplace, but do it in a creative way. We're going to see a flurry of activity, and then we're going to modulate that activity.
The federal government may be showing signs of that now, while the Obama administration appeared to place a low priority on prosecuting those who complied with state laws a couple of years ago. Recently, at least 8 states received letters from U.S. attorneys warning that dispensaries could face federal raids, fines, or criminal prosecution.
I suffer. I miss out on a lot.
It's a confusing mess for local governments and discouraging for patients who continue to fight for medical marijuana by circulating petitions and speaking out. Denise only hopes the smoke clears in time.
If you would have asked me 5 years ago that I would be doing this, I would have said, you're crazy. And now I'm an advocate. There are people that it will help.
To have medical marijuana legalized in Florida, a proposal would have to pass the House and Senate with 60% support. Then a ballot question would be put to voters to add a medical marijuana provision to the state constitution. That would also need 60% support to pass.